KVIEN. It's a pleasure and an honor to have you here. Could you please comment on achievements made by rheumatology in the last years?
Yeah, so first of all, it's also a pleasure for me to be here in Bucharest again. So I think that the most important things for the clinical care of patients over the last couple of years is that we have got new classification criteria in spondyloarthritis and rheumatoid arthritis, which really make it possible for an early diagnosis and early treatment, and this also linked to the treat to target recommendations and the Eular recommendations for pharmacological management of rheumatoid arthritis and psoriatic arthritis. I think these are major achievements for clinical practice.
Can you make a prediction what this year will bring us as new and bright in future?
That's more difficult. So I think that we all the time we see that there are new pharmacological principles coming up, not only for treatment of rheumatoid arthritis but also for treatment of other inflammatory conditions. My biggest wish would have been that we should have a new agent for osteoarthritis, but we are not there yet. So I think that for the future, to have a disease-modifying therapy for patients with osteoarthritis, that is really the main goal for the future.
That's for sure, it will help us all.
Yeah, because osteoarthritis, that's really the disease which is increasing, both because people are becoming more obese, but also because we are becoming older, of course.
May I ask you a question about, you're not the first time in Romania, so what do you think about rheumatology in Romania and about Romanian rheumatologists?
So I think that there are several positive dimensions in that. So first of all, I think that the colleagues in Romania, they are very relaxed and nice people to deal with. That's one dimension. The other dimension today, for example, we have had case discussions. And I must say I was impressed about the comprehensive assessment that was done in the patients, and also that all the clinical assessments and the results from lab tests and the various procedures, it was really put into a nice context of a plan for diagnosis and treatment. So I was very impressed with the quality of the cases and what had been done with the patients that were presented today.
Thank you. So you think that, considering the cases, also the practice, the rheumatologic practice in Romania, could be considered as quite good, or at least in our centers where some of the, let's say, more highest center in rheumatology in Bucharest and in the country?
Yeah, so it seems from what I saw today and what I've also seen before, but that has, as you indicate, maybe been from the university department. So it may be different in other places, but what I've seen today, for example, it was impressive.
Oh, thank you very much.
Dear Professor, can you bring some advices for Romanian rheumatologists?
If you then think especially about the young rheumatologists or rheumatology in general, I think, from my perspective, I think it's so important to try to set up some research programs in parallel to the clinical work. Because if you, let's say, I usually talk about early arthritis clinics as a model. Because if you, for example, manage to set up an early arthritis clinic, then you need to have collaboration with the primary care, you see the patients early, you start early with treatment, you set a target, and then if you collect the data, then you also train the doctors, and especially the young doctors, in research and methodology at the same time as you provide optimal treatment and management for all the patients. So I think that's important. Another issue that we discussed today was, for example, the cardiovascular opportunities, you can say, in patients with inflammatory joint diseases. So to set up some preventive programs to reduce the risk of cardiovascular events in patients with spondyloarthritis and rheumatoid arthritis, that's also an opportunity in the future, I think.
So you see that there are some good conditions for future mixed programs for research in rheumatology, including cardiovascular disease and complication, yes?
I think so, and we should always think in a multidisciplinary way. But the principle that it can also be drug registries, for example, the principle that when you have a patient, managing the patient in the clinic, if you're then able to collect not so many data, but just a few data so that you document what you are doing with the patient in clinical practice, and that's about quality of the care, and then you can use these data also for analysis and perhaps also publication at a later stage.
I was impressed when I visited your clinic that in every room was a person who was preparing something to be published, or a PhD or a paper. Everyone was doing research. So do you think that this is the future of the rheumatological department to have, as you said previously?
It may be that you also had an overrepresentation of the researchers that you met. So there are actually also doctors in our department who are rheumatologists and seeing a lot of patients who are not so dedicated to research, or perhaps not doing research at all. And we need those, very trained clinicians as well. So, but I think that the most important thing is that you have a research activity, so that you have a focus on evidence-based medicine, and that you implement new knowledge and evidence in your clinical decision making. I think that's the most important part.
So, I think that's it. Thank you very much.
Thank you very much.
If you want to make a final comment or for the Romanian Society of Rheumatology?
Yeah, no, it's as I said, I have enjoyed very much the case discussions today, and I enjoy the friendship with rheumatologists here in Romania. So thank you very much again for inviting me to Bucharest.
Thank you very much, Professor.